Hi everybody, my name is Dr. Cassie Turner and I am Program Director here at Murphy-Deming College of Health Sciences in the Doctor of Physical Therapy program. So I would like to welcome you and take you on a brief tour of that program. The DPT program at Murphy-Deming has been in existence since 2014, with the first class graduating in 2017. We are a full-time, on-campus, cohort-based program, which means that the students that you start the program with are your peers that you complete the program with. And as of 2025, we will be going to a program that is just over 2.5 years. As of 2022, we were fully re-accredited by CAPT, which is the primary accreditation agency for physical therapy education. And that accreditation is good for the next 10 years. So that's something that you want to consider when you're looking at programs. Are they fully accredited, or are they still trying to get their accreditation, for example? And in 2022 and 2023, the students that graduated in those two cohorts, we have a 100% overall pass rate on the National Physical Therapy Examination, which is the exam that you have to take in order to seek licensure. And 100% of those who are seeking employment are employed. It's still a little bit early for our 2024 graduates. They've only been out of the program for a month, but they will be sitting the examination shortly. And I estimated close to 96% of them, when they came back to campus for graduation, already had job offers or jobs secured. So for our program, we really work hard to align with the American Physical Therapy Association's vision, which is transforming society by optimizing movement to improve the human experience. And as physical therapists, we get to work with patients and clients of all ages and abilities, and in a variety of settings. I think many people understand that we do a lot to rehabilitate people from injuries and illnesses, but we are really focused these days as well in helping patients and individuals manage their chronic conditions and also avoiding surgery and the use of prescription drugs. So particularly in light of the opioid epidemic, we are really working hard with helping patients with low back pain, for example, and helping to avoid that turning into a chronic condition that may become dependent on medications. And of course, we're trying to encourage people to have healthy habits and also educating individuals on how they can maintain their health and fitness in all types of settings, and again, for all types of patients. We often use exercise and manual therapy techniques as part of our treatment. We also use some modalities, and at Murphy-Deming, we really try to focus on educating you on those modalities that have the most support and evidence. And a big part of our patient care is providing patient education. And all of these photographs that you see on this slide are from our state-of-the-art facility. So Murphy-Deming is part of Mary Baldwin University, and as a student in the program here, our curriculum is structured so that by the time you are finished with your studies, you will be at the level of an entry-level physical therapist. So the first year is really focused on providing you with the basic skill set, covering the basic sciences and introductory courses where you learn basic assessment and measuring techniques. And then at the end of that first year, you will go out and do a short clinical, which is typically in an outpatient orthopedic setting. And then you come back for the second year and you'll get to learn about more complex patient cases. You'll get content in areas including neurological, cardiopulmonary, integumentary, pediatric physical therapy as an example. And then at the end of that second year, you will start your medically complex clinical, and then your additional 2 final long-term clinicals, which can also be in specialty settings. So for example, if you're interested in sports or pelvic health, we can assist you in setting up those more specialized clinical placements. And we do have over 600 contracts nationwide, so students do get to travel if they wish. And then we do require a doctoral project for our students, which means you're typically mentored by a faculty member with about 2 or 3 other students. And when you have completed that project, you will present that work to your peers and to the school and sometimes the community. And quite often students may even get to present that at a national conference or help write those findings up for publication. So lots of great opportunities within our program. So what could you expect as a student within our program? I think one of the most outstanding things we have to talk about is the accessibility of our faculty. We are a small program. We typically take 35 students per cohort, and every student is assigned a faculty advisor. They are also assigned a peer mentor, and we do our best to have an open door policy for our students. So if we are in our office, as well as having office hours, you can drop in, you can ask questions, you can ask help. We will really be there to support you through the entire journey. We also have a director of student services who is there to assist throughout the student experience and provide out-of-class activities as well. And we also, as I mentioned before, we have a state-of-the-art facility. And throughout our curriculum and our program, we have plenty of opportunities for community involvement, whether it be through volunteering or through the structure of some of our classes, where you get to go out and interact with clients in the community that may or may not have health conditions. So you get a little more practice during the program, including integrated clinical experiences, which are usually 4 hours, a couple of days a week through a couple of the classes that you will be enrolled in. So again, you get lots of practice, lots of involvement with patients and clients, and the opportunity to get skilled in your PT skills, as we would say. So if you do come and join us, you would be living in the Shenandoah Valley, which is a beautiful area to be in. Our campus is situated in Fishersville, so we are surrounded by countryside. We have some walking trails. I even see deer out on those walking trails. Many of our students live in the apartment complex, which is just up the hill from us. Our building itself also has plenty of quiet study places, and we even have a meditation space. The area itself is great to get out and hike and bike and kayak, and the farm to table scene is extremely fun to explore. And we are close to your regional metro areas. So we are only about 35 minutes from Charlottesville, close to Harrisonburg, and Richmond and Washington, D.C. are just a little bit further away from us. So lots to see and do, and a good place to come if you're looking for somewhere to study. So our admission requirements are covered on the next slide. And so you are expected, like most programs, to apply through PT-CAS. We do have a priority deadline of October 15th, but that just means that your package will be looked at more quickly than those that are coming in a little bit later. We do have a final deadline of May 15th, and as I mentioned before, we will be starting in 2025 in August. You do need to have a bachelor's degree by the end of May, and we require the prerequisite courses do have a C or better. We have a GPA preferred at 3.0, but please don't be afraid to apply if it is a little bit lower. When we say GPA, we're typically talking about overall GPA, but we will also look at your prereq GPA, your science GPA, and your last 60 GPA. And sometimes we'll see students, you might have struggled a little bit during freshman, for example, and then get their feet under them, and we see that last 60 substantially improve. We do require the GRE, but we're not looking for a minimum score. And we also require the TOEFL exam if English is not your primary language. And then we have a personal statement, and you need to have 40 observation hours, a total of 40 at least, in 2 different settings, and 2 references, with 1 being from a physical therapist. But we do not require an interview. So here's some tips to make your application stand out. We really do take a holistic approach, which means, again, we're not requiring that 3.0 GPA. Yes, we prefer it, but we're really going to look at your entire package of your application. So we want to see that you have passion for physical therapy. So if, for example, you're able to get more than 40 hours of observation, or you have worked as a physical therapy tech, that would be fantastic to include on your application. Or maybe you have been certified as a personal trainer or a CrossFit coach, or you have worked as a CNA. Anything that demonstrates increased knowledge of healthcare or exercise, for example, that would be important to put. And also demonstrating anything that shows a commitment to lifelong learning, because as a physical therapist, that's really what you're going to have to do across your career. Sometimes students do retake some of those prerequisite courses. So for example, if you've really struggled with anatomy and physiology, that might be a course to consider retaking. And also tell us your story. Tell us what matters to you. If you've struggled, if you've met some challenges, tell us about the lessons that you have learned and how you've overcome those challenges. And again, if you have perhaps been a student athlete or worked during undergrad, let us know, because that very often will show us that you are able to manage your time and your stress levels. And again, those are things that are really important for the journey through PT school. So we hope you consider joining us. We do frequently offer virtual information sessions and some open houses, so you can reach out to either myself or our admissions department. Our admissions department is fantastic at getting you answers about the admissions process, and also again providing information to you on our virtual and in-person sessions. And if you want to check us out and see what our students get up to as well, please follow us at MBU_PT on Instagram. And take care and best of luck in your journey.